Stand-up comedy is the personification of science.
Thank you. Good night. My name is Harold Bay.
Hello, my name is Dr. Harold Bays, Medical Director and President of the Louisville Metabolic and Atherosclerosis Research Center located in Louisville, Kentucky. Welcome to this series of YouTube videos entitled The Science of Stand-Up. In this series of YouTube videos, we are exploring the integration of the science of stand-up comedy to other academic sciences. As you know from prior YouTube videos, we discussed how it is that the science of stand-up integrated within theoretical physics. And then we followed that up with definitions of stand-up comedy, as well as the utilization of 50 common literary devices within the context of the science of stand-up. In this YouTube video, we're going to be talking about advantages and disadvantages of humor and stand-up comedy. Now, I am going to try very hard to remain positive. I'm going to try very hard to emphasize the advantages. But I think most of us recognize that for as long as there has been performances, there is this tension between tragedy and comedy. And I don't think that is, I don't know of another performance art that demonstrates that dichotomy more than stand-up comedy. So again, we're going to be exploring that in this discussion of the science of stand-up. So what are the advantages of humor? With regard to teaching, humor in patient counseling can help provide warmth and receptivity. In other words, your patients may be more receptive to your message if you add humor. Also, it should be noted that scientific presentations and medical presentations and medical counseling may be more effective when humor is added, but only if the humor is relevant to the topic. So what you can't do is just be giving a scientific presentation and then tell a bunch of jokes that are not relevant to your topic. That's not really enhancing education. The other thing is there has to be a level of confidence that the audience or the person with whom you're speaking, there has to be a level of confidence that you know what you're talking about. Again, no amount of joking around or humor is going to overcome bad science or going to overcome a lack of expertise on your part. So you have to know what you're talking about, and now if you apply humor to that, then the teaching can become potentially more effective. What is the neurological and neurophysiological underpinnings of the science of stand-up? What's going on in the brain? Well, first of all, stand-up comedy will stimulate those areas of the brain that are responsible for the reward center. And if there's various different types of imaging studies that are performed, such as magnetic resonance imaging, functional magnetic resonance imaging, if you were to have test subjects, be exposed to high funny clips, you will find that areas of the brain that are associated with the reward center will become, their activity will become heightened. So that's the reason that's appealing to folks. Stand-up comedy is appealing because it stimulates the reward system. Humor may also enhance communication. Many times if you add emotion to a presentation, whether it be positive, whether you're eliciting a positive or negative reaction, that can be remembered. Okay, that can be remembered with specific regard to comedy or humor. Sometimes just a smile or laughter or whatever eliciting those types of things or that sort of response from the presenter can sometimes enhance communication. It may also facilitate interaction by attracting attention, reducing anxiety, enhancing engagement, and building emotional bonds. So yet again, humor is a good way to bridge that gap between the presenter or the stand-up comic and the recipient, which would be the audience. Now, if you look at professional stand-up comics and you compare them to amateurs or controls, what's really interesting, and this is a study done in 2021. The name of this article is Funny Bone, Neuroanatomical Correlates of Humor, Creativity in Professional Comedians. What you may find is if you were to do, again, magnetic resonance imaging, you may find that with regard to professional comics, they may have an increase in the areas of the brain that are responsible for abstract divergent thinking and default mode network. Also, during periods of improvisation, there may be greater activation in that same group. Again, I think there's a difference between individuals engaged in stand-up comedy and individuals when they're engaged in stand-up comedy with regard to their neurophysiology. Okay, so that's the neurophysiology. What about health benefits? We always hear about health benefits, and I don't know, is that really true? I mean, is there any scientific evidence for this? Well, in fact, there is. Having a sense of humor or being exposed to humor can improve capability to manage life stressors with regard to coping. Post-encounter decrease in stress hormones can occur with humor. In other words, if you were to encounter a stressful situation by the application of humor, that they may diminish the post-encounter epinephrine, which is adrenaline, or cortisol, which is a stress hormone. So you may have post-encounter or after the encounter reduction in these stress hormones. May increase endorphins, and we all know about endorphins, and reduce the perception of pain. Laughter may improve mechanical lung function because you're using your lungs. May favorably affect the immune system. May favorably affect endothelial function, enhance vasodilatation and blood flow. So for those of us engaged in preventive cardiology, I mean, that's pretty important. May improve mood of hospitalized patients. I think many of you are familiar with the story of Patch Adams. May help avoid isolation of those with chronic illness and allow for continued integration and involvement with others. And that's very important. Humor is a good way to bridge that uncomfortableness when you have a friend or a loved one who is terminally ill or has a chronic disease, and yet, I mean, you feel bad, but at the same time, you want to have them encounter as much normalcy as is possible. And sometimes humor can help do that.
I think that we could use a great deal more of humor in medicine because I've always thought that with a medical problem, there needs to be a little humor thrown in, with it. And I feel like with the experiences I've went through, that if I hadn't had a little humor, I wouldn't be here.
What kind of experiences?
Well, I've had 2 bone marrow tests where they both panned out negative, thank God. And I've just had a few medical problems that if I didn't see the humorous side of it, I really don't think if I would have just give up, in other words, and got real serious and thought, oh my gosh, the negative forces there would tend to make you sicker. I think it's really a lot mind over body, according to what a person, perceives to be well or sick. I really believe in this.
Well, one part of it is your attitude, and one of the things we're curious about is how patients feel about doctors who try to kid around with them. If your doctor would try to, joke around with you, how would you feel about that?
Well, I had that experience, and it really helped me over the hump.
You have some incredibly long resume, and we should tell people that you do a lot of benefits.
Yes. I think in reference to what the woman was saying earlier, I couldn't agree more. with some of the statements she was making. One of the real problems, I think, in persons who have chronic diseases is they have a hard enough time dealing with their own disease, much less the perceptions that people have towards them. One of the things I like to say, I like to point out to people is I think there's really something called humor discrimination. And I think it occurs whenever someone contracts a chronic disease, everyone feels at that point that humor should no longer be anywhere in the environment of that person. Well, how could you possibly tell a joke in front of grandma? She has, a bad arthritis, or she has cancer, or she has heart disease. How could you possibly joke around her because she's sick? And so a lot of the benefits I do are for persons who have chronic diseases. And you might think it is totally insensitive and totally bizarre to do a comedy show for persons with cancer, or persons with AIDS, or persons with diabetes, or persons with chronic arthritis. But I'll tell you, it is such a relief to these persons when I get up there and I just, to me, they're people. I mean, just because they have a chronic disease does not mean they're no longer people. And so I do the same sorts of jokes and joke around and everything, and it's very rewarding.
It's usually the people that don't have the disease. It's usually their own anxiety.
You bet.
Not really the patient that has the problem.
I have a perfect example of that. I did a videotape, comedy tape on diabetes. It was reviewed by a group here in town that's involved in diabetes education. The people that watched the tape, the persons who didn't have diabetes that were in the group, were kind of offended by some of the material. Not that it was dirty or filthy or anything was wrong with it, but they were kind of uneasy. They thought patients wouldn't tolerate it.
They were really uncomfortable with it.
The persons who had diabetes loved it.
That's interesting.
And finally, the favorable effects of humor may be humor type specific. For example, the type of humor that may be well received and may have the best health benefits are, say, self-deprecating humor or wordplay or that sort of thing. If you start getting engaged in demeaning others or being engaging in humor at the expense of others, it may not be so helpful. Okay, may not be so helpful. All right, what about the caloric expenditure? What do we know about the caloric expenditure of laughter? Now, when I did stand-up comedy decades ago, I made my best guess as to how many calories you would burn doing laughter.
Harold Bays loves laughter, and he likes to see others laugh as well. He says it's good for your heart and health. He should know he's Dr. Harold Bays, a Kentucky physician comedian.
Do you know an attorney will represent you for $1,000? And should he be successful in getting you out of jail, it'll cost you $5,000. I know nobody else charges like that. Can you imagine a surgeon going to your 8th Maple and going, "I ain't Maple, need your gallbladder out, and I'm willing to do that for $1,000. And should I take out the correct organ, that would be $5,000.
What Dr. Bays likes about laughter is that it's a workout, a calorie burner.
If you were sitting over at one of these chairs over here and you were really, really laughing hard, okay, you were really cranking up and your stomach's hurting, I suspect, although I don't know of any studies, I suspect you're probably burning, maybe an additional anywhere from 3 to 4 calories per minute you could burn off. I'm not recommending this as a form of weight loss or anything, but...
And what better way to exercise some underused muscles? It's a belly burner, a heart pumper, and a jaw buster.
One of the things I find when people get done watching one of the comedy shows is they complain of their jaws hurting. And I think these are typically people that are maybe not accustomed to laughing a whole lot. They're not used to using these muscles. And they will walk out and they will say, "My jaw literally, it really hurts. Okay, I can't laugh anymore because it hurts."
Dr. Bays believes a hearty laugh should be a daily routine, and studies show those who have a good outlook, a positive view of life, live longer and happier. Denise Boyer, WREL TV News, Raleigh.
In 2007, this was actually evaluated in clinical evidence, and the energy expenditure of genuine laughter is about 4 kilocalories per minute. Most of us call it calories, but it's actually kilocalories. 4 calories per minute. Okay. Again, from a preventive cardiology standpoint, what are the cardiovascular responses to laughter? Well, there are a lot of things that we like to see in preventive cardiology. So, in this case, we're looking at cardiovascular response to laughter. This is a pilot project published in year 2000. During periods of 5 minutes each, while sitting in a comfortable chair, subjects first were rested and then viewed a videotape of a well-known comedian while they remained sitting. And in evaluation, while they were laughing, they had an increase in cardiac stroke volume, increase in cardiac output, and decrease in peripheral artery resistance. So it's very similar to physical exercise. In fact, laughing is physical exercise. What about to the stand-up comic? Are there any benefits from going into stand-up comedy? Unfortunately, we're going to get to some data here that suggests perhaps it's not so good, but I want to accentuate the positives. Remember that's what I said at the very beginning. And if time is used wisely, then that would allow for improved nutrition and physical activity. Now, things may be totally different now than they were decades ago, but when I worked as a road comic for 10 years, when I would be in the same condo or the same hotel or whatever with the other road comics, a focus on healthful nutrition and physical activity was not a priority. Okay, not a priority at that time. Maybe things are better now. I don't know. Another advantage or benefit of learning stand-up comedy techniques and having that experience is getting that sixth sense. One thing I can say is when I do a presentation, a medical presentation, I can just feel if there's a section of the audience that's not paying attention, or times when I need to lighten up, or times when I need to bear down, or times when I need to speak softer, or times I need to speak louder. All of these represent a sixth sense that I developed through my years of doing stand-up comedy. Another thing is you develop a very thick skin. That's also very helpful in academic presentations. I was doing a surgical rotation, and the surgeon thought it would be a good idea to withhold a patient's basic information from me, even as I was presenting in front of the lunch grand rounds. Okay, so grand rounds is where you present a patient case in front of an audience, and then they discuss it. So since I didn't have any of the information, when everybody started asking me questions, I had no answers because I wasn't provided the information to give them the answers. And as a result, I was just being crushed. I mean, the surgeon who did not give me the information was just merciless. And so for the first and only time in my life, I had an out-of-body experience. My in-body experience was that I was answering the questions basically with, I don't know, and I was humiliated. The out-of-body experience was that I was observing the crowd, and these were nice people there at the hospital where I was giving the grand rounds. They're nice people, and I think many of them were shocked what the surgeon was doing to me. He was just merciless. But at the same time, you could just look at them and they're like, well, you know, we hate what's going on here, but we're glad we're here to see it. You know, you could tell they were enjoying the show. So that's very similar to, for example, a stand-up comic doing a comedy show and encountering a heckler. People don't like it that there's a heckler. They object to it, but they're glad they're there, and they just want to see how it is that the comic handles it. So, you know, just something for them to talk about later on. My point is this, is that having that stand-up comedy experience allows me to have a thick skin so I can respond to a pressure situation within academic presentations. Again, talking more about energy expenditure, it isn't just the laughter where you can burn off calories and such. It's the thinking. Folks, performing stand-up comedy is very intense. It requires lots of thinking. There's a lot of dynamics going on where you're trying to remember your material, and how to gauge the crowd, and your movements, your articulation, and there's just countless things that go on when you're performing stand-up comedy. And to give you just an extreme example of how much mental strain or mental stress, you know, what that can or mental utilization, what that can do as far as energy expenditure. Here are chess grandmasters can lose 10 pounds and burn 6,000 calories just by sitting. So again, I'm not saying that performing stand-up comedy is like being a chess grandmaster, but I am saying that it can result in energy expenditure based on neurophysiology, thinking, having to perform and remember and conduct stand-up comedy very much in the way that's been described by this series of YouTube videos of the science of stand-up. All right, so those are the positives. The disadvantages, look, I'm trying to be objective here, but this is just the reality. First thing is, stand-up comedy is hard. There's a quote that's attributed to Edmund Kean. It says, "Dying is easy, comedy is hard." Here's a picture, a blurred picture of the movie Troy, where you have Achilles, who's the individual that will be the representative to fight the representative of Troy. He's getting ready to go into battle, and there's this child, and the child looks up to Achilles, who is on the horse, and the child says, "The Thessalonian you're fighting, he's the biggest man I've ever seen. I wouldn't want to fight him." And then Achilles, he looks down in disdain, and he says in a low voice, "That's why no one will remember your name." And that sort of crushing to this small child. It's a little intense or whatever, but I think the essential point here is that, folks, if you want reward, sometimes you got to take the risk. And there are risks to doing stand-up comedy or incorporating humor in presentations. For example, colleague jealousy. Too many times if you add a bunch of humor to your presentations, then your colleagues will say, well, the only reason he gets invited to do talks because he just tells jokes all the time. Not true, but that's how people react. Second thing is, no matter how hard you try, you're probably going to offend somebody. Unless you restrict your comments solely to self-deprecating humor, puns or wordplay or whatever, probably going to upset somebody. Finally, not everybody finds humor amusing. Not everybody shares your politics. Folks, I hate to break it to you academicians out there, but not all people in academia are of the same political ideology. I know it's hard to believe, but it's actually true. And finally, this is one that drives me the most crazy is people say, well, I don't really have to worry about off-color jokes that I do or whatever because everybody knows me. Everybody does not know you. I don't care who you are. Everybody does not know you. So no, you can't get away with just anything. And then there's the case of, we hear about cancel culture. I have an entire YouTube video on that, but there's this condition called offendophilia where people just love to be offended. Philia means love, and we know what offend means, so offendophilia, people who love to be offended. Now, let's be clear. There are folks out there that consider themselves woke. In other words, they've awakened to the awareness of issues of social justice, and they want to make it right. That's not who I'm talking about. I get it. Some people need to be held accountable, and it's great that there's people out there that want to hold people accountable. And, I understand that. Okay, and truth be told, cancel culture has been around for centuries. Our country was built on cancel culture, and as I said, I'm going to be talking about that. But the issue that I'm talking about, and I think the issue that drives people crazy, are the situations where we have people that act not as defenders of social justice, but just vacuous busybodies. And that's the problem, is that wokeness and such has sometimes devolved into a caricature of those who wake up in the morning just looking for reasons to be offended. And look, folks, if your main objective in life is to harm a person's career or cancel somebody's lifetime accomplishment because you don't agree with them, then that's a problem. Okay, that's a problem. We all make mistakes, and I think there ought to be a path for forgiveness. And I have an entire YouTube video that will be dedicated to forgiveness, which is something I don't think we talk enough about. And taking it one step further, sometimes the offendophilia can be reactionary, where you have folks that be railing against social injustice, but at the same time they gravitate towards violence as a solution. I oppose hate with every fiber of my being. That's why when I encounter those with whom I disagree, or those who make mistakes, I throw bricks, burn down buildings, beat people senseless, and insist they lose their jobs and cancel their career. If that's the way you think, then you're the problem. Okay? Then you're as much of a problem as the individual for which you disagree. I'll give you an example of how this is nothing new. It was about 30 years ago. I'd written something in the local medical periodical, and I was doing something that I thought was humorous, and I had a throwaway line. Something had to do with Catholics and fertility or something. I don't remember what it was, but it was very short, very nothing, very vanilla, whatever. And I got a letter. And the letter talked about how this person was mortified that I would suggest that that Catholics have a certain opinion or church doctrine with regard to fertility and such. And it's like, wow, mortified? I mean, I can understand where you might say you object, or I need to be careful about that, but mortified? And even decades later, so you can imagine how society has evolved over time, but even decades later, here in 2015, the Pope said no Catholic needs to breed like rabbits. So again, this wasn't my perception. I wasn't playing on a stereotype that wasn't already out there. I'm not saying it was right what I did, but mortified? I mean, was this person mortified with what the Pope said? I certainly didn't say anything like no Catholic needs to breed like rabbits. I can tell you that. I didn't say that. Okay, so I'm wondering if she wrote the Pope. Another example is about 25 years ago, I was doing a show. It was a middle show on a Saturday. Got done with the show. And, you go out and you talk to the audience, and this woman came up to me, and her husband's behind her, and he's sort of cowering in the back. It looked like he was kind of afraid of her. And she says, she goes, well, Dr. Bates, obviously you did very well, and the audience seems to like you, but I found you to be, very offensive. I was like, whoa, offensive? And, I don't use the more graphic language, the blue language. I don't talk about explicit sexual things. I'm racking my brain. I'm like, what could I possibly have said that offended this woman so much? And she says, well, at one part in your routine, you said the word wacko Taco Bell. I said, yeah, it was a throwaway line. It was all of 2 seconds in a 30-minute comedy routine. I said wacko Taco Bell. Yes, I did. And I was still trying to figure out where she was going. And she said, well, wacko, some people might take wacko and feel that an analogous word for wacko would be crazy. I was like, okay. And said, and crazy is a pejorative for mental illness. Okay. And she says, and I work with people who are mentally challenged and who have mental illness, and it's just very offensive. And I was like, ma'am, when I said wacko Taco Bell, I was referring to the Tex-Mex restaurant chain. I was not referring to a person. Okay, you familiar with Taco Bell? They have the foods you can get them fresca style. They have pico de gallo. They're 150 calories, 6 grams of fat, 2 grams of fiber, so not too bad. Former President Barack Obama chimed in on this a few years ago. And again, this isn't some right-wing zealot or anything, Barack Obama. And he was quoted as saying, Obama has criticized what in 2019 he called woke culture that leaves little room for forgiveness. And again, got a whole YouTube video on forgiveness, something we don't talk enough about. For misdeeds of people in public life. This idea of purity that you're always politically woke and all that stuff, you should get over that quickly. The world is messy. There are ambiguities. People who do really good stuff have flaws. And you can read the rest of the quotes here, but I just want to go to the bottom, which cuts to the chase, and just says, calling out others on social media is not activism. Folks, sometimes people just make mistakes. That upon further reflection, they say, yeah, I was wrong. You don't need to be calling for their jobs or ruining their careers or crushing them in social media. Again, that's not me talking. That's former President Barack Obama on cancel culture. So here's a checklist of things to know, things to look at if you want to know if you have offendophilia. Are you self-absorbed while simultaneously obsessed about criticizing others? Do you believe that your failures are due to the success of others? Are you intolerant to the lives and opinion of others? Are you unable to agree to disagree? That comes up all the time. I'll be in a conversation with someone, I'll say, well, look, we just disagree. And I want to move on because there's no point. We're not going to convince each other of the other person's opinion. I'm like, that's okay. We can agree to disagree. But there's just some people that is not satisfying. That is not sufficient. I need to comply. Okay, I need to succumb to their opinion, because if I don't, then I can be referred to by a bunch of really unfortunate names. Do you have tortuous thought processes, like referring to Mexican Tex-Mex restaurant chains? Do you prioritize symbolism over solutions? Too many times they're like, well, I want to show my support. And I'm like, well, why don't we do something to fix the problem? No, I would prefer just to show my support. Just a different way of thinking, I guess. Have a preference for intimidation versus a discussion. Insatiable craving for attention. Believe that empathy and compassion are competitions. Competitions. It's like, well, I'm offended this much, so that makes me a better person than you. And then I would come back and say, well, I'm actually more offended than you, so that makes me a better person. Then they come back and go, no, I'm doubly offended now, and so now I have surpassed you, as a worthy human being. And all of these things, again, these things have always been around. People like this have always been around and everything. But I think it's the last checkpoint here that has really changed in the past few years. And that is, for a person with offendophilia, they have a remarkable desire and ability to suppress or cancel or hurt other people. And that's where I have a problem. Is you can have all kinds of disagreements or aspects of being intolerant to other points of view, but when you set out to try to hurt other people and be openly critical of other people without respecting what they intended or without respecting their opinions, and you want to get them fired or you want to harm their career, I think that's crossing the line. Again, that's not just me talking. It's former President Barack Obama. All right. What are the potential hazards to the comic, to the stand-up comic? Well, let's talk about stress and travel. There are a lot of things that happen when you're on the road and you're in clubs all the time and you're away from your family and your friends. And I think this helps influence whether ultimately you have the pros of being a stand-up comic or the cons of being a stand-up comic. So the pros are, hey, you get invited to do things. You get invited to clubs. You get invited to speak. That's great. The cons are, particularly in academia, you may not be taken seriously. So that would be the con.
I hear patients saying, well, if my doctor tried to kid around with me, I would be really unhappy. And I hear patients say, I want my doctor to be real. I'd like him to kid around with me. What do you think? You're a comedian. You know more about this than most people.
Well, I think there's a difference between what people think that they want and what they truly want when it comes down to it. In theory, I think most people would agree. I want a kind of doctor that's just a regular person. I want them to be able to relate to me on a personal level and be just a regular person. On the other hand, I remember an experience. I did a kind of a internship training thing in a town in the western part of the state. And the internist came up to the patient and said, I think you have gallbladder disease. I'll never forget this. It's an experience that has kind of altered the way that I think of myself in practice. And he says, I think you need your gallbladder taken out. And she goes, well, what surgeon do you think? And he said, well, I think Dr. Jones would be a good surgeon to take out. And she goes, oh, no, I would never have Dr. Jones take my gallbladder out. And he says, well, this physician was obviously confused. He says, well, why not? And she looked at him and she said, well, I heard he drinks. He says, well, he might go out and have a beer every now and then. Oh, well, no, I could never have a surgeon that would drink a beer in public. And I just think this is real prevalent in the way that people view their physicians. I mean, I think in theory, most people would say, I want kind of just a regular person taking care of me. But when it comes down to who's going to be taking, for example, with me, I don't do a lot of comedy here in Louisville.
Because?
Because my practice depends upon referrals. And, no matter how hip or how enlightened you think your physician is, when it comes down to referring that next patient, they say, well, you can either go to Dr., Ms. Smith, you have diabetes, cholesterol, and a thyroid disorder. You can either go to Dr. Jones, who's a known convicted felon and who has bad personal hygiene, or you can go to Dr. Bays, who's a stand-up comic.
Yeah.
I better go with Jones on this one, I'm thinking.
Yeah.
You
really... Well, that points up one of the main issues here. Comedy is usually perceived in a medical environment as uncaring, maybe insensitive, and it directly, it's diametrically opposed to the image that most physicians are trying to cultivate. But the real irony is that the humor and the comedy really has a healing effect in the relationship stress reduction. We're going to go into that in more detail in a little while. Do your patients know that you do stand-up comedy?
Many of them know, but it's something that is quickly brushed off when they come in the office.
No,
I mean, I have in my practice, because so much of what I do is education and dealing with their multiple medical problems. I run a very kind of subspecialized practice. For one thing, I simply don't have the time to be joking around. The second thing is, again, I don't want to be perceived as a funny guy. Well, my doctor's a funny guy. I mean, I do research. I write papers. I've got a lot of academic background, and I think at least when I'm taking care of patients and patients' family members, I think I would rather be known as the academic physician rather than as Dr. Bays, the stand-up comic.
Pros are when you're on the road. Oftentimes you're alone. You're alone in a condo, or you're alone in a hotel room, or whatever. And so for some people, being alone is just fine. They like being alone. The con is being alone, because sometimes people don't want to be alone. And there's a lot of downtime, a lot of alone time as a road comic.
Or like to second kind of what you're saying as far as how it feels to be up on stage. I'm kind of claustrophobic when it comes to being around large groups of people. If I'm in a kind of a big crowd or an elevator, I mean, it really, really makes me nervous. And so I don't like to be in those circumstances. And people know that. And a lot of times they'll come up to me and they say, well, how is it that if you just really can't stand to be around like people just all around you and behind your back, and if that really makes you that nervous, how can you stand in front of 200 or 500 people and do a comedy show? How can you possibly do that? And I think what people don't realize is you are never more alone than when you're up on stage in front of people doing stand-up comedy. You are very lonely. There is no feeling of claustrophobia up there, I can just tell you. Sometimes you kind of wish there were people.
Yeah. Pros, you get to judge other people. And that's cathartic when you can stand up on stage and just rail against other people. Same time, you can be judged. I mean, if you get in the public eye, you can and will be judged. And the issue I have here, and this is something I believe for many, many years, anyone who looks back on their life and says, I would not change a thing, is either delusional or never had a life. I mean, how many times you heard people say that? I look back at my life, I did it my way, I wouldn't change a thing. I don't know who these people are. That's not me. I mean, let's just stop there. Let me just say, a lot of things I would definitely change if I had to do it over. Stress reduction. If you're up on stage, you're having a good set, you're getting all these evil humors out of your body and such. It can be cathartic. Again, stress reduction. But if things aren't going well, it can increase stress. So that would be the con. The pro would be stress reduction, and sometimes the con would be increases stress. Pro, therapy for dysfunctionality. If you're a dysfunctional person and you do stand-up comedy, sometimes, the affirmation and validation you get from doing well on stage, something you need. Got to have it. On the flip side, it can create dysfunctionality, because if you get rejected or dismissed, that can only feed the disease. Feed the disease. We're going to talk about that here in a minute.
It must be very hard to get up in front of an audience and do stand-up comedy. I think that's one of the most vulnerable positions you can possibly be. Oh, what if they don't laugh? What if nobody laughs?
That has never happened.
What if they throw?
I have never been in front of a crowd where they didn't laugh. No,
Yeah.
that is something that has happened to me. I think in the realms of the comedy world and all the annals of comedy history, I have probably died some of the most painful comedy deaths in the past 8 years of any comic that there is. I mean, I could tell you story after story of just miserable experiences. And one of them is because of the position that I'm in, there is a lot of types of humor that I can't do. All right?
Mhm.
I can't talk about certain subject matters, and I can't use certain types of language. And I'm just saying, no matter how good you are as a comic, there are some places in this country, some clubs, that unless you give them a certain type of comedy,
Mhm.
you're in for trouble.
Mhm.
Rocky roads. And so I have run into, problems like that.
What you've written about comedy.
Yes. I've written articles for the Professional Comedians Association.
Now, this is really interesting. I mean, you're published in the medical literature. I mean, you're a recognized researcher. You're published in the medical literature, and at the same time, you have credits to writing about comedy.
Well, I think I have a real. It's just like I guess anybody else when you get involved in people with the arts. A lot of times people that are in artistic type of activities, whether they be musicians, and of course I know a little bit about being a musician, or the performing arts, it ain't all peaches and cream. And you see what these people have to put up with. And you see the kind of, the horrible living conditions and the terrible pay and the problems when people don't laugh or if they don't appreciate the music. And you just feel for them and you want to do everything you can for them. So what I tried to do in these articles, in a humorous way, I tried to present what they could do from a medical perspective to improve their own medical care, but did it from a comics perspective.
Yeah. It's even more than just not getting paid. It's almost, if they don't laugh, it's almost a rejection of you.
Boy, you couldn't be more right.
Yeah.
That's persons who do stand-up comedy, well over 50%, if not a whole lot higher, usually have some quirky personality thing anyway.
Yeah.
I mean, and it's a little bit different than music. I have played a lot of music gigs where we'd be up there playing, there'd be maybe 10 people in the crowd. We didn't care. We had a ball. We were playing good music, and as long as we played well, we had a ball, had a great time, and there was no problems. With comedy, there's immediate feedback. It's just you by yourself, and if you stand up there, and it doesn't matter how good you are, if they don't laugh, then you have been rejected.
Yeah.
Pros, sense of accomplishment. Cons, sense of failure. Pros, rush of reaffirming excitement when the crowd's going crazy. Ovation at the end of your performance. It's a rush. On the flip side, when things don't go well, soul-crushing demoralization. All right, so what is the psychological state of those who are stand-up comics? Okay, so here's a study that was done. This was published in 2016, looking at dramatic actors and comedy actors and such, and stand-up comics. And what they found were that stand-up comics were younger than comedic actors and dramatic actors. And I would say that would be consistent with my experience. Stand-up comics died at an earlier age. And the better they were as a stand-up comic, the shorter their longevity. Here's a conclusion. Elite stand-up comedians, more highly rated, in other words, the better they were by the public as rated by the public, the more they were likely to die prematurely. So folks, I'm trying to be objective here. I don't want to be doom and gloom, but this is the data. Elite comedians are at increased risk of premature death compared to their less funny counterparts. And again, this is another article. Mental health issues and personality characteristics that help shape their comedic talent and their success may well explain their reduced longevity and raises serious issues for identifying and mitigating their risk of premature death. Here's a study where they looked at psychotic traits in comedians. And it turns out stand-up comics have an increased rate of having psychotic traits. They scored especially high on scores related to loneliness, asocial behavior, and lack of mood control in social situations. So here's a summary that I think puts it all in perspective. What are reasons why it is that stand-up comics may die prematurely? I would say cigarette smoking at least 20, 30 years ago was fairly prevalent among stand-up comics with whom I worked. I mean, I didn't smoke, but they did. Alcohol, yes, but I think a lot of performers drink alcohol. Drugs, illicit drugs. The thing about illicit drugs, if you were taking illicit drugs to the degree that it was harming your cognitive ability so you couldn't perform at a comedy club, you're not going to get any work. You're not going to get any work. So I can't say that I saw or was aware of major drug issues with the stand-ups, the road stand-up comics with whom I work, because, again, it's a very cognitive intensive vocation, stand-up comedy, very mind intensive. You have to be on top of it, and if not, word gets out very, very quickly, and you don't work. You just can't cover that up. So I saw a lot of cigarettes, a lot of alcohol, not so much the drugs, although I'm sure it happened. I remember one headliner I was working with, he was talking about how it is that he checked himself into the program. I was like, what's the program? He goes, a rehabilitation program. I checked myself in a few months ago in California, checked myself in. I'm like, oh, well, that's terrible. I mean, what were you addicted to? I mean, I'm so sorry. And he goes, well, I really wasn't addicted to anything. I'm like, why would you check into a drug rehabilitation program if you weren't addicted to anything? He goes, well, it's a good place to meet people in the industry. I was like, what? I'm like, oh, yeah. I mean, look, I do drugs every now and then, but I wasn't addicted. But, I just know so many people here, the movers and the shakers and stuff. And I've been a headliner for about 5 years now, and I've not gotten a comedy special, and I don't know how to make connections, so checked myself into a drug rehabilitation program. Well, I'm sure that you had a higher chance of treatment success than other people, so I guess that's the good news. Here's a list of some folks who died, whether they be stand-up comics or comedic actors. Robin Williams died at 63 by suicide. Lenny Bruce died at age 40, morphine overdose. Mitch Hedberg died at age 37, drug overdose. Richard Jenney, I thought he was going to be the next big thing. Richard Jenney died at age 49 from suicide. Ollie Joe Prater died at age 45 from obesity and stroke. Tim Wilson died of heart attack at age 52. Bill Shaker died of cancer, age 46. John Candy died at age 43 from obesity and heart attack. John Belushi died at age 33 from drug overdose. Chris Farley died at age 33 from drug overdose. So you can see here that these kind of figures and dying at such a young age validates or is illustrative of the data that we just presented. I mean, stand-up comedy is hazardous. Or you could say that the people that tend to go into stand-up comedy have personality traits that lend themselves to premature death. And it isn't just death of the individual, which makes this all the worse. And folks, I promise I'm trying not to be doom and gloom. But again, this series of YouTube videos is entitled Science of Stand-Up, and I'm just telling you the science. These are the facts. So here's an examination of Robin Williams. a stand-up comic, did a lot of TV shows and such. He committed suicide. And they looked into his life, and they found in this article that he had some of the more common risk factors associated with suicide. He had issues with relationships and finances and drug addiction and major depression. So the conclusion in this article, published in 2016, is that the chances of committing suicide drastically increase in the presence of any of the key risk factors. Any of the key risk factors. Unfortunately, the actor Robin Williams was dealing with 4 of the major risk factors altogether, which put him at high risk of committing suicide and eventually led to his tragic death. Sort of interesting how they characterize Robin Williams as an actor. You know, he was a stand-up. For many years, he did stand-up, but they characterize him as an actor. And then the next shoe hits the floor. Suicide of a stand-up comic is potentially contagious. Here are not 1, but 2 articles talking about the potential contagion that is suicide amongst stand-up comics. First quote, suicides increased in the United States and Canada months after reports of the suicide of the comedian Robin Williams. Another quote, suicide rate can increase following the suicide of prominent celebrities, especially if the media coverage is detailed and sensational. So what does it all mean? What does this all mean? What it means is you don't have to be funny. You don't have to be funny. If you're a scientist or you're someone who wants to do presentations, you do not have to be funny in your presentations. I know a lot of people are enamored by humor and the science of stand-up. That's the reason I have these series of intensive YouTube videos so people know what they're getting into, know the nuances, know the risks, know the benefits, know the advantages, know the disadvantages. That's the purpose. That's the purpose. It's how is it that all of these sciences, and in this case what we just talked about is the psychological sciences, how does that apply to the science of stand-up? And that's what I'm trying to accomplish. And I think that's what I'm going to continue to try to do as we examine the science of stand-up in future YouTube videos. Please click the subscribe button to add this channel to your YouTube TV subscriptions. Click the notification bell so you'll be notified of new content. Click on the like button if you like this YouTube video. Click on the share button to send this or email this or send it on Twitter or Facebook to other folks. And as with the other videos, I would like you to focus on some questions and place them in the comment section. First question, why do you believe stand-up comics have a higher rate of unhealthful lifestyle habits, depression, and premature deaths compared to other performers in other professions? Now, as I said, maybe nutrition and physical activity is different now than it was 25, 30 years ago. Maybe that's true. But I don't think there's convincing evidence that the psychological aspects of stand-up comics have changed. So why do you believe that stand-up comics have a higher rate of unhealthful lifestyle habits or depression and premature deaths compared to other performers and other professions? Thank you for your attention, and I hope you'll stay tuned for future YouTube videos regarding the science of stand-up.